Okay, so when I say the word melatonin, what's the first thing that pops into your head? Sleep, right? Of course. But what if I told you this little hormone has a secret life? A pretty major one, actually. One that's putting it right at the forefront of the fight against cancer.
And that is the big question we're diving into today. We know it helps with sleep, but could it actually help fight cancer? Well, there's this growing mountain of research that suggests melatonin could be a really powerful new ally in cancer care. And honestly, some of the findings are, well, they're pretty remarkable.
All right, before we jump in, just a quick but super important heads up. What we're talking about here is all based on scientific research. It is absolutely not medical advice. The whole point is to give you the information, the science, so you can have a smarter, more informed chat with your own doctor, okay?
So here's how we're going to break it all down. First, we'll talk about what melatonin is beyond just a sleep aid. Then we'll get into this surprising cancer connection. After that, we'll see how it might act as an ally in treatment, how it could ease the burden of cancer itself, and finally, we'll look at what the future holds.
All right, let's kick things off. Let's really get into what melatonin is, beyond that little bottle you might have on your nightstand.
So, yeah, we all know it's the sleep hormone, right? It runs our internal clock, but that's just scratching the surface. Melatonin is a serious multitasker. It's a key player in our immune system, and it even helps protect our brain and nerves. The big thing to remember is this: it's not just for sleep. It's a fundamental hormone that's busy working all over your body.
Okay, so how in the world does this connect to cancer? Well, this is where things get really interesting. Researchers started noticing something, a connection that was, frankly, pretty surprising. Get this, when they started comparing melatonin levels, they found this huge difference. In a lot of cancer patients, their levels were only at about 20 to 30% of what you'd see in a healthy person. I mean, that's not just a little dip, that's a massive drop. And you can bet that made scientists sit up and go, whoa, what is going on here?
And they've seen this trend in a bunch of different cancers, but the link they found with prostate cancer, that's where the data gets especially jaw-dropping.
Okay, so check out this one study. They looked at men who had two things going on. Their melatonin was low compared to their stress hormone, cortisol, and they had high PSA levels, that key marker for prostate problems. The result? Those men were nearly 9 times more likely to get a prostate cancer diagnosis. 9 times.
And hold on, because it gets even more intense. It wasn't just about getting a diagnosis. For that exact same group of men, the odds of having an advanced stage of the disease, a staggering 32 times greater. That's not a subtle link. That's a giant, flashing neon sign pointing to a connection between low melatonin and how severe the cancer is. And look, this isn't just a prostate cancer story. They've found similar connections, though the data can be a bit more mixed in some cases, with breast cancer, ovarian cancer, colorectal, even oral cancers. It really suggests there might be a much bigger pattern happening here.
So all of this leads to the really big question, the heart of what we're talking about today. If there's this strong connection, could melatonin actually step in and be an ally during cancer treatment?
Now, to be super clear, nobody in the research community is suggesting this replaces things like chemo or radiation. Not at all. Think of it more like a sidekick, a teammate. It's being studied as something that works with the standard treatments to hopefully make them work even better.
And the potential impact? It's huge. There was this massive meta-analysis back in 2011. That's where they combined the data from a whole bunch of different studies, in this case 21 of them. And they found that when you added melatonin to chemotherapy, it was linked to a 40% reduced risk of death after 1 year. Not only that, but patients were responding better to treatment overall.
And that wasn't a one-off. A more recent analysis, this one from 2020, focused specifically on high-risk prostate cancer patients. And what did it find? The same thing. It concluded that melatonin, on its own, was a factor that more than doubled the chances of survival, on average adding more than a year to these patients' lives. That is just incredible.
Okay, so survival rates are one thing, and they're obviously incredibly important, but there's another huge part of the cancer journey, just quality of life, getting through the treatment itself. And this is another area where the research is really compelling. Remember that big 2011 meta-analysis we talked about? Well, it also found that patients taking melatonin with their chemo reported feeling better. They had significant reductions in some of the absolute worst side effects, that bone-deep weakness, the nausea, and those scary drops in white blood cells and platelets that can put treatment on hold.
And here's a really specific human example for you. There was a trial in 2020 with advanced lung cancer patients. The ones taking melatonin at night, they actually said their shortness of breath got less intense. Think about that. Meanwhile, the group taking a placebo, their breathing actually got worse over the same period. That's a powerful difference.
Okay, so at this point, you're probably thinking, this sounds amazing, but what about the practical stuff? Like, how much are they using? Is it safe? And where does this go from here? Great questions. Let's get into it.
Okay, first and most important thing to get straight. We are not talking about the dose you take to help you sleep. Forget the 1 or 3 milligrams. In these cancer trials, the doses were way, way higher. The most common dose was around 20 milligrams, but some studies have gone all the way up to 1,000 milligrams a day. That's a completely different ballpark.
And that, of course, brings up the question of safety. I mean, 1,000 milligrams, that sounds like a lot. But what's so remarkable in all of these studies is just how safe melatonin appears to be. Even at those super high doses, the only real side effect that kept popping up was, well, some drowsiness. Which for a sleep hormone kind of makes sense, right? The bottom line is, the research shows it's incredibly well tolerated.
And so, all of this leads us to the final and maybe most frustrating question. It's a question that researchers in this field are asking themselves. You have all this compelling evidence. You have an amazing safety record. So why isn't this being studied more? Why isn't there more funding for big clinical trials? It's the central puzzle, really, at the heart of this entire story.
So, the big takeaway is that there's this really fascinating story unfolding in the world of medical research. And our goal here was to arm you with that story, to give you the knowledge. Because the most important thing you can do is take this information and use it to start a conversation with your healthcare provider, to make sure you're exploring every single option on your own health journey.